measles infections top 1,000 nationwide, Health and Human Services Secretary Robert F. Kennedy Jr. announced he is removing every member of the Centers for Disease Control's Vaccine Advisory Board. He made that announcement in the Wall Street Journal. The American Medical Association and other medical organizations say that decision is meant to stoke distrust in vaccines. Your reporter, Gabriela Vidal, has been looking into how this move could affect vaccines as we move forward. So, Gabby, what are you hearing tonight?
Well, Karen, it's really important for the medical community to have a specific guidance on how to issue the vaccine and when to issue it, and they rely on this committee in order to do that. And RFK Jr. is saying that there are biases right now in the current appointees, which is why he said there needs to be new ones. But now medical people in the Denver community are worried that making new appointments to this committee could lead to distrust and confusion about the vaccine.
I wonder if you can get it without an autism diagnosis.
When it comes to administering care to children,
We see probably, 75 to 80 or more patients in our clinic, and in any given day, I would guess that maybe half of them are getting vaccines. We have to keep our vaccines stored in these refrigerators.
Pediatricians like Matt Guerrieri say it's crucial to build trust with families about the importance of vaccines.
And we're able to do so under the guidance of a trusted organization like the ACIP.
Guidance that's been stripped away after Health Secretary Robert F. Kennedy Jr. removed all 17 members of the CDC's Advisory Committee on Immunization Practices.
There was no advance notice to the committee.
CU's Dr. Edwin Asturias, a pediatric infectious disease expert, was one of those members who's concerned about who will be appointed to fill these roles.
I think our major concern is that if suddenly the committee is named and appointed people that don't have the expertise on vaccines and don't have the trajectory of looking after, vaccination in the same rigorous way, parents will have some hesitancy of those recommendations.
Guerrieri also worries these new members may make recommendations against certain immunizations, like measles or the COVID vaccine, putting insurance companies in a position to opt out of covering families who may still want their kids vaccinated.
Some of those vaccines could end up being quite expensive for parents to pay for out of pocket, and that creates issues of equity.
Right now, typically members are picked for this advisory committee over a year-long process. It is unclear at this point if the new appointees will go through a similar process. But right now, medical experts are urging families who are seeking any guidance about the vaccine to turn to different organizations like the American Academy of Pediatrics for additional guidance. In Denver, Gabriela Vidal covering Call to First.